Well, thank you so much, Dr. Pang, for joining us today. This is really exciting to talk to you because you're going to talk to us today about the oral microbiome and about our biofilm and hopefully what steps we can take to improve it. And I think this is a really big topic because microbiome is a huge topic, isn't it? I mean, we now know how important microbiome is to our health, both our gut health and our oral health and our whole systemic health.
Absolutely. No, thank you, Suvi, for having me on. Yeah, no, we talk about the microbiome generally, and people think about the gut because that's the bacteria that most people are thinking of. But it all starts really with the mouth, the foods that we eat, when we breathe, when we drink, everything goes into the mouth, and then from then on goes to the rest of the body. So in the gut, we know that there's a couple of thousand different types of bacteria. In the mouth, we know there's somewhere around the 700 sort of mark, and a lot of those bacteria are supposed to be there. They're what we call commensal bacteria, and they work together with our body to make us healthy and allow us to taste certain foods, and you know, that's how we sort of recognize the products that we put in our mouth. And there are other types. They're what we call the opportunistic or pathogenic type bacteria. And when they're present in too high numbers, that's what we call dysbiosis. And you know, we hear about dysbiosis in the rest of the body, but dysbiosis in the mouth can cause problems like tooth decay and gum disease, you know, which we call periodontal disease and things like that.
So tell me about biofilm. So your practice is actually testing people's biofilm. How does that happen?
Yes, very much so.
Yeah.
So we have a system that we use, which involves a light microscope, and we take a little sample from the patient's teeth, and we put it onto a little microscope slide and put it under there, and then we can actually show the patient blown up to close to 1,000 times the original size, and we can see all of the bacteria that were in the mouth. We can see them wiggling on the screen, you know, how they're moving and so on. Yeah. And we can instantly sort of tell a couple of things. We can give the patient an idea of what is the bacterial load, so how much bacteria is in their mouth, what kind of distribution of the bacteria, sort of where it is, how it's different from the front of the teeth to the back of the teeth. And then we can show them specific types of bacteria which have certain shapes, like the spiral ones, which are called spirochetes. If we see too many of those, we know that that's going to be an issue for them in the longer term. That's the ones that can cause problems with implants, around dental implants, and gum disease as well.
Can you explain how important our oral health is for the rest of our body? Because I know I looked at another one of your presentations that you did, and you were talking about how it can affect even adverse outcomes in pregnancy. It can affect heart disease. Is that right? Like, what sort of things can it affect?
Yes, absolutely. So there's a couple of conditions which we know have what we call sort of bidirectional relationships. So certainly the ones that we talk about most commonly would be cardiovascular disease, diabetes, and then pregnancy complications. Yeah. So, for instance, in cardiovascular disease, when the oral bacteria are disseminated, so they travel into the bloodstream, then they, you know, travel along the arteries and veins, and so they can cause inflammation within that system. They call it the endothelial system. Yeah. And so when there's endothelial disease or inflammation, that will affect how the blood vessels will respond to things like, you know, blood pressure. So there'll be blood pressure changes. They can be more accumulation of plaques and cholesterol in there. Yeah. And then it can even disrupt it to the point where you can have breaks in the vessels, and then that can lead to thrombus, so which leads to cardiovascular, so heart attacks and strokes even.
Yeah.
Then we know that with things like diabetes, that the diabetes will not only make the periodontal disease worse, because there's so much excess sort of glucose running around in the bloodstream, but periodontal disease as well can make diabetes worse. So it's very much a two-way relationship.
Yeah.
And then if we think about something like in pregnancy, of course, we have the fetus growing in the mother, and if the oral bacteria have made their way into the bloodstream, they can travel, go down to the placenta, sometimes even go through the placenta and into the child. I mean, there's a disease called syphilis, which is, it's still very much a communicable disease,
Yeah.
which is sexually transmitted.
Yeah.
And congenital syphilis is where the child can get it from the mother, and that can lead to some very severe deformities in the child. So it's a terrible condition, and that those spirochetes will travel past the placenta and into the baby. So yeah, it can be a problem.
Oh, yeah. And what about diseases like Parkinson's and Alzheimer's? I know you briefly mentioned that there could be also some link between oral microbiome, gut microbiome, and neurodegenerative diseases as well.
Yeah, certainly. I mean, there's different ways that the bacteria will travel around the body.
Yeah.
Certainly, if it's in the bloodstream, then it can travel again to the brain via there's the blood-brain barrier there. Yeah. But in conditions, for instance, like sleep apnea, where that blood-brain barrier becomes leaky, or if like I said, in endothelial disease, where it's letting too much through, so it's kind of like leaky gut, you get leaky areas into the brain, then these bacteria will pass into the brain. And when the researchers have sampled the microbiome of the brain itself, they have actually found these spirochetes and other bacteria. So the brain has its own microbiome again. And they think that this contributes to what they call neuroinflammation, so inflammation within the brain. And then when combined with things like a poor diet, you have the transport of amyloid beta and tau plaques into the brain, and then this when you have too much of these accumulations, that's when the brain function is no longer optimal. Then that's where you can have conditions like dementia or possibly Alzheimer's, possibly Parkinson's as well. I mean, it's a very broad area of research. And there's certain bacteria that they're targeting. They're looking at spirochetes. They're looking at another one called Porphyromonas gingivalis, P. gingivalis. That's another one. So with the gingipains that come from the P. gingivalis, that is something that they're looking to target and see if that can help to manage and prevent Alzheimer's.
Yeah, wow. So how do we develop our oral microbiome from babies? I assume that this starts right from when we're born, or maybe before we're born. How do we get this good bacteria in first?
Yeah, it's the same way that the microbiome on the skin develops, and in the gut. It often is transferred from the mother. The baby will swallow that amniotic fluid, so whatever's in that fluid that they're going to be ingesting. And then, soon after birth, the bub is put straight onto the mum's breast. If they're able to breastfeed, then they're going to be getting, the bacteria that's on the skin, that's in the milk. And certainly later on, when parents start feeding the babies, they're going to be licking the spoons and kissing the baby. And so, of course, you're going to get the transfer of these bacteria into the child as well. And that's completely normal. But you've got to understand, if mum or the parents are sick and they come into contact with the baby, then that's where these problems can happen. I mean, we hear of, someone in the family having a cold sore, for instance, and they kiss the baby, and if you kissed around the eye, that can lead to blindness. If you kiss around the mouth, you can have all these cold sores and various sores around the mouth. So it's it's not virus, but it's a bacteria. And I think with COVID over the last couple of years, people understand that these things are transmissible between people. It's no real different. The bacteria are all over our bodies, and so it should be fairly understood that these things can pass from one person to another.
Oh, absolutely. Well, so the big question is, how do we get that balance then? Like obviously we want the good bacteria in, because I've also heard that you can be too clean. So what are we doing? How do we get this good bacteria to thrive in our mouth and getting rid of the bad stuff?
Yeah, it's not as easy a question as you would think. It is about balance, because it's not about killing all the bacteria, because we certainly need them to be there. I mean, if we kill in antibiotics and if you have heavy antibiotics and you get rid of the good flora, that's when bacteria like Clostridium difficile can overgrow in the bowels, and then you can have real severe problems. So in the mouth, we don't think typically that it needs things like antibiotics or anything that will eliminate all the bacteria in the mouth, but we're trying to find things that will help restore that balance. So people have made probiotics. There are some mouth rinses like either hydrogen peroxide or peroxyl. And then nowadays you can also get tumblers which can make ozonated water, and we found that has been very, very helpful for our patients. They can brush as normal and then rinse with the ozone for ozonated water for a minute or so, and we've seen within a couple of months the oral microflora has changed from something that we would look at and we see a lot of movement, we see a lot of those spirochetes, to something that's hardly moving and looks a lot more of the commensal type of bacteria. So that's really exciting, because that's ultimately the aim.
Yeah, so ozonated water, can you tell us a bit more about that? So I've never heard of it actually. Is it just water that's got extra oxygen filtered through it? Is it a bit like spring water, which has got extra
it is.
carbon? Yeah. So
any industry that deals with water actually uses ozone. Ozone is used in all the water treatment plants around the world. They use a combination of ozone and ultraviolet.
Okay.
And then industries, all the food industries use it, restaurants use it, ice making facilities, they definitely have it, but also childcare, aged care facilities, sometimes they have ozone tabs which they can use to wipe down surfaces, to wipe down things like toys and so on. So ozone, and even there's industrial cleaning companies that sort of have ozone sort of production facilities. And when they use the ozone is actually antiviral, antibacterial, and antifungal. So, and the good thing about it is it actually will break down over a number of hours, breaks down to water. So you'll have essentially clean, bacteria, virus-free water, after the ozone is gone. But the way that we're using it is actually actively. So we have a unit which is in the dental offices that generates about 4 parts per million, and then we can use that as a preoperative rinse. So they come then, they sit down in the chair, and they'll have a rinse, and that basically rids the mouth of the viruses and the bacteria at a very superficial level, mind you. But it definitely drops the numbers down. But if you've ever been to the dentist in the last couple of years, you would have had a mouth rinse of some sort. Often they use either iodine or what else did they use? And sometimes they use peroxyl and then or ozone. So these are what typically is used in the dental office. But when we use it in our dental chairs, it actually cleans the dental lines. And then we use it in the dental handpieces. I use it in my dental laser. It's in my airflow cleaning device. So that's when we're cleaning the mouth, we're actually spraying ozone into the mouth, and that simply just reduces that pathogenic biofilm that's in the mouth, and helping to kind of restore that balance. You've got to understand that it's not a once-off treatment that you can do. It's something that needs to be just continually done, and then over a period of months, it will those numbers will come down, because the bacteria are just too good. They're just too strong. And even if you remove 99.9999%, there's still that small percent. But because we're talking about billions and billions of bacteria, they will grow again. And it's just you just need to help restore that balance. So the ozone's been very, very good for us in that way.
So how do we get hold of one of these tumblers? Because I actually would really be interested in buying one, to be honest, for our household. Can you just get them from?
Yeah, they're at the moment they're fairly specialist item. There's dentists that are typically selling these ozone tumblers.
Yeah.
They're made by a company called Biofilm, who do industrial type ozone equipment for all sorts of industries.
Yeah.
But we've got access to them, and we sell them in the office.
Yeah.
And anybody can. I mean, it's really very safe to use. It takes about 2 minutes to generate a tumbler full of ozone that the patient can use.
Yeah. I'd be. Are they expensive to buy?
They're $400.
Oh, okay. Yeah. So it's a bit of an investment.
It is. Yes. It is something that has to be. It's for the person that needs it, and we certainly, when we have a look at the biofilm, we understand if the numbers what will warrant it or not. Otherwise, we generally always start off with the peroxyl or hydrogen peroxide.
Okay, because I remember I went through a phase of using Listerine to obviously get rid of the bad bacteria in your mouth, and my mouth turned black. So I think I was overdoing the Listerine. So I'm really aware of that now. I must have probably wiped out all the bacteria, whereas I'm assuming that ozonated water preserves the good bacteria and isn't wiping out any of the bad stuff. So,
well, it's not quite. It's not quite as simple as that. But certainly the things like Listerine have essential oils in there. And some of the other mouth rinses like Savicol has chlorhexidine in it, and that's the one that typically will stain the teeth quite strongly. You use it for 2 weeks and you're going to get stains in your teeth.
All right.
But it is what we might recommend maybe immediately after some surgery, but that's really the only case where we might recommend Savicol.
Yeah.
And the ozone, it again doesn't actually discriminate between the different types of bacteria. It does have that O3, so it does have that extra oxygen that dissociates, and that's the oxygen radical, and that knocks out the bacteria because they don't have the same antioxidants that human cells have. So that's why we can rinse with the ozone. We've got no problems, but it knocks out the bacteria. The thing is with the pathogenic bacteria, they typically are more susceptible to the ozone treatments. And especially if there are too much of them, by just reducing the numbers, we're kind of giving the commensal bacteria an opportunity to grow, because they're typically much more fast growing than the pathogenic bacteria.
I understand. Yeah. So you reduce the bad, you let the good flourish in that space, so that they're. Yeah. Well, it's like red light therapy, really, isn't it? Too, like that's a bit of an investment to buy a laser. I've got a handheld laser at home. Can laser help our oral microbiome at all? Because I know it has been shown to help our gut microbiome. Do you think infrared light can help?
It does. It helps in pretty much the same way.
Okay.
I guess I would think that it would be most helpful, again, if there is some sort of dysbiosis.
Yeah.
So, I mean, there are conditions where, for instance, chemotherapy and radiotherapy, where you've kind of knocked out a lot of not only the cells that are growing very quickly, but you can also knock out some of the bacteria in the mouth. And when that happens, you change that balance, and so people tend to have a lot of mouth ulcers. They're more susceptible to cold sores and things like that. So if you can then use the light, and they've shown that over many studies, that it can be the ideal treatment for those mouth ulcers and that oral mucositis that happens as a result of cancer therapies. So definitely we know that it helps to boost the immune system. It helps to reduce inflammation. Yeah. And if there's areas of pain, it helps with pain as well. But there is a possibility that the bacteria can also flourish perhaps a little bit more effectively under the light. So, whether or not it's selective for some of the commensals or the pathogenic bacteria, we don't exactly know. But we know certainly when there's severe dysbiosis, and certainly if in occasions where there are ulcers and other problems in the mouth, that it is very, very helpful.
Yeah. Do all dentists check your biofilm, or is this something more specialized that you offer?
Oh, no.
No.
No. Now, this is something that I've been doing for about a year. There's a group of us that do it, and I think there's maybe about 5 in Sydney that do it, and there's around about maybe 50 now across the country that do it. But it's an investment in the microscope, and that you do need to understand the implications of why you would want to check the oral bacteria. So it's something that ideally yes, all dentists should be doing, but certainly that's not something that they're worth considering for them at the moment. And I think that'll change in time. Right now, dentists are very aware that bacteria cause gum disease and cause decay, but the link with cardiovascular disease and some other systemic health conditions, even things like cancers, or liver problems, kidney problems, those associations, they're considered associations at the moment. But I think the important thing for most dentists to understand is that periodontal disease, like many of these chronic health conditions, they're all inflammatory conditions. A lot of the pathways tend to be the same. So if you're having problems with your gums, there's a good chance you could have problems, with some of the other systems in the body, and there can be these comorbid conditions that are also becoming a problem. So once that awareness becomes more realized, then I think people are going to be looking at this technology a bit more closely.
Can you share any success stories of anyone that's come to you and you've suspected a really poor biofilm, tested it, it's come back, and you've been able to help them improve it, and health-wise, maybe they've improved?
Yeah, we can, we've been using it now, so we can share lots and lots of stories. I mean, everything from, and I shared some of these cases with you where, there might be a 12-year-old with some swollen tonsils, and when we have a look at their microbiome, all of a sudden we see all of these bugs running around. There's these spirochetes. We have some patients with sensitivity, and when we look at that, we can see, the bacteria being really, really active. But a couple of the ones that jumped to mind are, we had a patient that had some stents put in, and he asked me if he needed to let me know about that, and I said, okay, I think this is important. Let's test your biofilm, and when we did that, we saw huge numbers of spirochetes. So they're the spirochetes generally come in three families. So there's the treponema, which is the type that can cause syphilis, but they also have a different type that causes periodontal disease and early implant failures. There's another genera called Borrelia, and you would have heard of that with Lyme disease. And there's a third genera called Leptospira, which is leptospirosis. So with the mouse plague that happened, in the country, those spirochetes are in the urine of the mice, and when they wee on some foods and other animals eat it, that's when they can have problems. So, these spirochetes were in his biofilm, and they were very, very active, and they formed these star shapes, which are indicative that it's a really bad problem. And over a period of months, he was able to use the ozone and have cleaned, and we saw his biofilm completely change to the point where it was almost not moving. It was really great to see. So.
Yeah, and that's going to give him better success with his stents in his heart, isn't it? Because if you're cleaning out his mouth, then that's going to have a big impact on him, surely.
Yeah, I think so. I mean, that's something that, with the biomarker testing that we can do as well, and other heart checks that he'll do. Hopefully, we'll see some of his numbers improve. But from a dental point of view, when we're placing implants, we've completely changed our protocol now, so that we will test the biofilm of our patients before we place an implant. We make sure that the mouth is healthy before we would even think about placing an implant, because we don't want to have the implants fail after we put them in. It just it's not good for either party.
Oh, exactly. It's just, a big use of time and money for everyone. Yeah, definitely. If we can't get our biofilm tested, what are our best chances of having a healthy microbiome? What would you advise us to do? Like a brush every day, I guess, obviously, twice a day. What would your oral hygiene routine look like?
Yes. I mean, typically the hygiene for most people would be to brush twice a day and to clean in between the teeth, and that can be with floss, it can be with interproximal brushes, it can be with things like they have different kinds of water flosses which shoot water in between the teeth. Anything that will disrupt the bacteria and the areas that they like to hide are going to make the mouth more healthy. And when we talk about, the health of people, I mean, 30% of adults typically might have periodontal disease. So it's important that they go to their dental professional and have their teeth checked. The thing that has become really quite apparent to us is that even though it looks clean, it doesn't necessarily mean it's healthy. When when there is bleeding, there doesn't seem to be a safe level of bleeding or a healthy level of bleeding. Inflammation is simply that, inflammation, and there's a reason for that. So if you can get to someone that can test your biofilm, then all of a sudden you're going to be well ahead of the curve in terms of how early you can get treatment, because these bacteria, they do take time to develop in the mouth. It's not something that happened just over a week, or you had a big weekend and all of a sudden you've got all of this in there. These do take time to develop, and which also means that they've been in the body and around the body, and probably traveling throughout the organ systems of the body for quite a while. So the earlier you can get to these treatments, the better. And hopefully, ultimately, what we want to try and do is to prevent these patients which have early signs of gum disease, prevent them from going down the path where they're going to get problems like Alzheimer's, Parkinson's, or cardiovascular disease, diabetes, and so on. So, the earlier the better, in my view.
Absolutely. And I guess every health professional would advocate a diet rich in fruit and vegetables, but are there any magical foods that can help with your cut down on plaque? Because I have read that dark chocolate, as in the really dark stuff, like 99% type dark, can coat your teeth with a little bit of it. It's sort of a bit antibacterial. Also xylitol. I've heard xylitol can cut down on some of the bacteria in your mouth. Is any of that true, do you think?
Well, I think that certainly we know that a low sugar diet, or one which doesn't have a lot of added sugars, is the better type of diet to be on.
Fruit, vegetables.
There's certainly a lot of controversy around some of the other diets, and I think whether you're on a ketogenic type diet, or an Atkins type diet, or say or on a Mediterranean type diet, the research is now showing that individuals have a specific type of diet that's ideal for them, and that's part of the genetic testing that people can do. They have there's 4 types of ApoE genes, and depending on what type, you can actually determine what type of diet is best for you. So there's a particular ApoE4 type gene, which you cannot be on any type of fat diet. You want to reduce the fats as much as possible. So that's completely different to what most people think about in the Mediterranean diet being quite healthy. But it's quite individual. But I in general, I would say more natural foods, definitely fruit and vegetables, less processed type foods with certainly no trans fats, and reduced processed meats, I think as well would be ideal, and that's difficult. But there are some studies which show that on a high fat diet, that there can be more cases of periodontal disease, there can be more cases of dental caries as well. It's quite interesting that I was just reading a paper that as obesity increases, there is periodontal disease related to obesity as well, and some of the myeloid precursor cells can actually become overactive and start to affect the jawbone as well, and cause bone loss. So it's definitely a two-way relationship, and you can't just look after one part of the body and expect another part not to be affected as well.
Everything is so multifactorial, isn't it? Like in medicine and yeah, health. And so interesting that it can be so individualized as well with the diet. So it really isn't one diet fits all.
Very much so. Yeah.
Very
There's a great
interesting.
there's a great book called Beat the Heart Attack Gene by Bradley Bale and Amy Deneen. And
Mhm.
that's a really good one to read. They have a second book called Healthy Heart, Healthy Brain,
Oh,
and those two books are really very groundbreaking in terms of how diet affects the rest of the body and how a good diet will affect brain health as well. You know, when we test for the 11 types of different bacteria, it sort of gives us a real sort of quantitative number that it's no longer just kind of bacteria on the screen. We kind of have numbers that we kind of can use and go, okay, well, this is what it was like before, and this is what it's like now, and we can see that improvement and things like that. So yeah, I mean, and then you can use it in combination with other biomarkers for the rest of the body. You can look at CRP for the body, or you can look at cholesterol levels. There's other markers like IL-1, IL-6, we just talk about systemic inflammation. There's, I don't know, have you heard of carotid intermediate thickness? That's in the,
heart.
you look at the carotid arteries and at the thickness of the wall, that can reduce when everything is healthier as well. So
Oh, wow. And do you think there
yeah.
might be less of a need for children to get their tonsils out if their oral microbiome is healthy? Like you mentioned, that patient that you had with really severe tonsillitis, and that improved when the biofilm improved.
I think that's a tricky one because it depends why the tonsils are inflamed, and sometimes it can be because they're mouth breathing, or they genuinely have an infection that they've got, and it's gotten into the tonsils, and so you have to take antibiotics for that. Um, so it's kind of still very individual, but certainly we know that if the mouth is healthier, then there is probably a reduced chance of having things like even tonsillar cancers or mouth cancers, and then the downstream effects from that is less gastrointestinal cancers, pancreatic cancers as well. So it's we definitely want to get the mouth healthier.
Oh, it's pancreatic cancer. That's a terrible one to have. So yeah, if a healthier mouth can help prevent things like that, then for sure. And we've come a long way, I
Yeah.
think, in terms of understanding things. Like going to the dentist is no longer just getting a hole filled, is it? It's actually vital for your whole health and well-being, really, isn't it?
Yeah, it's so important for people
Yeah.
to realize that looking after their oral health is really looking after the rest of their body as well, and it can be an early sort of marker for when something's going on with the rest of the body. Like for instance, when we have a few patients and we have a look at their biofilms, and all of a sudden we see a whole lot of white blood cells on the screen, and we say, okay, have you been sick lately? They say, oh yes, we've had COVID. We're still recovering from COVID and things like that. And you can see those kind of effects in those films. So it's really interesting. That, I mean, I've sent you some other sent you some of those other films where I think, did I show you the ones? I sent you a time lapse of the
Yeah.
amoebas. Yeah,
Yes, that's
that's a
fascinating.
scary one.
It is a
Yeah,
very scary one. Time lapses of bacteria are very frightening. It's like the apocalypse, isn't it? Like they can certainly take over. Is there any age limit that you would think is more sort of urgent to get your biofilm tested? Is it more important as we get older? I mean, I know you've mentioned children as well, but um, Does our biofilm and oral microbiome deteriorate as we get older?
Yes, very, very much so. I mean, our immune system doesn't work the same, when we're 21. So there's a term
Not
called
much does.
and immunosenescence is the reason why the people are recommended to get vaccinated. When they're in their 70s and so on. It's why they're getting their fourth boosters when they're immunocompromised. So it's the same sort of thing. If the immune system is not working well, then that's where these bacteria can take advantage, and they can be overgrown, because the white blood cells, all your body's systems for fighting off these bacteria, if they're not working as well. So typically in a chart of periodontal disease, we see it just start to climb from 30, 40, 50 onwards. The numbers are just increasing, to quite high levels. It's well over 50% for the over 50 to 70 year olds.
Right, yeah. And this is probably a no-brainer, but if you do have a healthy oral microbiome and a healthy biofilm, are you less likely then to get caries and need root canals and stuff like that?
We know definitely caries for sure. If you don't have the type of bacteria, especially what we call Streptococcus mutans, that's one of the ones that causes holes in the teeth.
Yeah.
If you have less numbers of that, and generally less bacteria in the mouth, you're going to get less holes, because there's less acid producing bacteria that are in the mouth.
Yeah.
As to whether or not how that relates to the rest of the body, they have now done studies where they've taken the thrombus, the clots that form in heart attacks and so on. When they've tested those, they've found the same oral bacteria in those clots, directly linked to the mouth. So we know that it for sure that it travels around the rest of the body.
Wow. So it's so important, isn't it, really, to then keep our mouth as healthy as possible for the rest of our health. And this is something that we're just discovering really now. So, I mean, we've sort of known it for a while, but it's becoming more mainstream, isn't it, really, to understand this?
Exactly. Yeah, that's right. It's becoming more on the forefront, and there's more discussion about that link. It's more than just an association now. That it's not necessarily causal, but it can develop in parallel. So when you have cardiovascular disease, you can have in parallel periodontal disease, and so that they're not necessarily linked, but certainly one can affect the other. And if you can treat one and the other can respond as well, that can be a really good thing.
And you're opening the discussion between the medical community and the dental community in terms of, because I noticed, I saw in one of your presentations that letter between you and the medical doctor back and forth with your patient for the good of the patient. So you're opening up. Yeah.
We try and write to the primary care physician or their specialist, and let them know what's happening within the mouth, because we know that, for instance, with cardiovascular disease, so we want to write to their heart specialist, and tell them that this is what's happening in the mouth, and these are the steps that we're taking to reduce the contribution of these bacteria to the overall systemic inflammation. So if we can cut that down, then they've got a better chance of coping with the rest of it.
And isn't that what it's all about? Yeah. That's what it's all about, isn't it? Giving our patients, your patients, the best chance at a healthy life. It's just great. Thank you for being a trailblazer in this area, and thank you for, again, sharing this really important information. I think I'm really grateful to have learned this, and I know viewers will be very interested too. So just thank you so much for your time.
Well, I'm glad. I'm glad you're interested, and thank you for, for always being interested in things like the lasers and
Oh yeah,
photobiomodulation
yeah.
and this this biofilm. It's quite an interesting sort of journey that you've been on,
It is.
investigating all of this.
It is. It's a definite learning curve, but it's so beneficial for me and my family. And with the lasers you mentioned, even my French bulldog is benefiting from it because red light therapy helps with his joints and his skin issues. And so we just benefit from learning all this new information that's coming out too. So just it's a real honor to speak to professionals like you, and just very grateful to you for sharing your knowledge with us. Thank you so much for your work.
Oh, thank you, Suvi.
And you
Great
have
to talk to you again.
yes, absolutely. We'll have to do round 3. Let me know when you come up with new things, and I'm always interested to talk to you.
Okay.
You have a
Thank you.
good
Keep well.
you have a
All
good
the
night.
best.
Yeah, you too. Thank you.
Thanks. See you.
Bye.